Madam President.
Senator from Minnesota.
Madam President, I would ask that the quorum call be vitiated.
Without objection.
Thank you. Madam President, I'd like to talk a little bit about health care reform. Soon, over 1 million Minnesotans will have the opportunity to buy their insurance on insurer, Minnesota's health insurance marketplace. Minnesotans who buy their own insurance on the health insurance marketplace, including Franny and me, will have the opportunity to compare plans and choose the coverage that works best for their families. Not only will MNsure make the options clearer and more accessible, but the health reform law is also making sure that Minnesotans feel secure in their health coverage. That's because insurers can no longer cap the amount of benefits that you can get over the course of your lifetime. They can't drop you if you get sick, and they cannot discriminate against you based on a pre-existing condition. And there's a lot in the health care reform law that a lot of Americans don't even know about yet. For example, I championed a couple of key provisions that are improving the quality and the value of health care coverage that we all rely on. I authored a provision requiring health insurers to provide a good value for your premium dollars, and I helped to establish a national fund for health care prevention. Now, why is this especially important right now? Well, because the House of Representatives passed a continuing resolution to fund the budget that also defunds the health reform law. So before we decide on that measure, I want to make sure that we remember what is in this important law. First, we are requiring insurance companies to give their customers good value for their premium dollars. One thing that many Americans don't know is that millions of Americans are getting rebates from their health insurance companies when those companies don't provide that value. I wrote the provision that does this. It has the catchy name medical loss ratio, which is sometimes called the slightly more catchy 80-20 rule. Because of my medical loss ratio provision, which is based on a Minnesota state law, health insurance companies must spend at least 80% of their premiums on actual health care. Not on administrative costs, not on marketing, not on profits, not on CEO salaries. And if insurance companies don't meet the 80% for individual and small group markets, or the 85% for large group policies, well, then the insurance company has to rebate the difference. And the fact is, my provision is working. Last year, nearly 13 million Americans benefited from checks from their insurers, and this year, about 8.5 million Americans benefited from rebates that were sent out in July of this year. And that's a good thing, fewer people getting rebates. This year is a good thing, because that means that insurers were saving you money on the front end, instead of rebating you the money on the back end. And that is part of why health care costs have risen in the last 3 years at a slower rate than in any time in the last 50 years. Now, is that entirely due to the Affordable Care Act? No. But in contrast with what's being put out here and being put out there, we are not seeing the cost of health care spike. In fact, just the opposite is true. I'll say it again. Healthcare costs have gone up less, have risen at a slower rate in the last 3 years than at any other time in the last 50 years. The bottom line is that my provision is making insurance companies more efficient and helping keep health care costs in check for people, and I'm very proud of that. People also don't know how much we did to improve access to preventive health care in health reform. Anyone who's ever gotten a flu shot knows that an ounce of prevention is worth a pound of cure. Along with former Republican Senator Dick Lugar of Indiana, I fought to get the National Diabetes Prevention Program included in the health care law, the health reform law. And it exemplifies the benefit of this kind of reform to our health system. This program, which was piloted in St. Paul, Minnesota, by the Centers for Disease Control and Prevention, involves structured nutrition classes and exercise at community-based organizations like the YMCA. It has been shown to reduce the likelihood that someone with pre-diabetes will be diagnosed with full-blown type 2 diabetes by nearly 60%. That's pretty good. And the program doesn't just make people healthier. It also saves everyone money. The diabetes prevention program costs about $400 per participant, as compared to treating type 2 diabetes, which costs more than $7,000 every single year. That's why United Health, the largest private insurer in the country, that also happens to be headquartered in Minnesota, is already providing the program to its beneficiaries. In fact, the CEO of United Health told me that for every dollar they invest in the diabetes prevention program, they save $4 on health care costs later on. This homegrown program is funded out of the Prevention and Public Health Fund, which is another program in the health reform law that is designed to invest in evidence-based health care prevention in communities across the country. In Minnesota, the Prevention and Public Health Fund has supported tobacco cessation programs. It has helped to prevent infectious diseases, and it has expanded our desperately needed primary care workforce. Preventing disease while saving money. Preventing disease while saving money. That's smart reform. We did a lot of other things in the health care law, too. I worked with several of my colleagues to develop a value index, which will change the way Medicare pays physicians to take account of the quality of the care that the doctor provides, reward quality instead of quantity. My home state of Minnesota is the leader in delivering high-value health care at a relatively low cost. And traditionally, we have been woefully under-reimbursed for it. For example, Texas gets reimbursed almost 50% more on average per Medicare patient than Minnesota. Now, this isn't about pitting Minnesota against Texas or Florida. It's about rewarding these states, those states, to become more like Minnesota. Imagine if we brought Medicare expenditures down by 30% around the country. It would bring enormous benefits, not just to Minnesota, but across the country, because it will bring down the cost of health care delivery nationwide. I'm working very hard to make sure that health reform works for Minnesota. The implementation of any major reform is going to be a challenge. But I don't think that Minnesotans or Americans want us to keep looking backwards. They want us to move forward and to implement the law as best we can. They don't want the House of Representatives to waste precious time and vote to repeal the law for the 42nd time. The fact is, if the law is repealed, a lot of things Americans like will be taken away from them. Americans don't want seniors' prescription drugs to go back up. They don't want children with pre-existing conditions to be kicked off their health plans, which are just a couple of things that would happen if the law were repealed. Last year, more than 54,000 seniors in Minnesota got a 50% discount on their covered brand name prescription drugs when they hit the donut hole in Medicare Part D. This discount resulted in an average savings of $644 per person, and a total savings of more than $34 million in Minnesota alone. And we're not done. By 2020, the donut hole will be closed completely. But the closing of the donut hole, would go away if we repealed the health reform law. And thanks to a provision that allows young adults up to the age of 26 to stay on their parents' health insurance, 35,000 young people in Minnesota and more than 3 million young people nationally were able to keep their health coverage. Those young people would be kicked off of their coverage if we repealed the health care law. Health reform also ended insurance companies setting lifetime limits on the amount of care that you can receive. So if you or a loved one gets sick, you can never be told by your health insurer, that's it. No more coverage for you. You know, go ahead, file for bankruptcy. And guess what? If Congress repealed the health reform law, that would go away too. I'm not saying the law is perfect, but if there are problems, the American people want us to work together to fix them, not refight old fights. And that's what I hope to do, move forward by implementing the law and making any changes that we need to make along the way. Millions of Americans across the country are already experiencing the benefits of this law. I urge my colleagues to join me in supporting the implementation of the important provisions that I have outlined here today. Thank you, Madam President, and I yield the floor.